Today's class we will see about in-service education. In-service education, why it is necessary in the healthcare industry. All either the doctors or nurses or physiotherapists, we are getting our degree and we are settling in our job. We are working in a different places and the different kind of institution we are studying and coming, and we are going to the different kind of the institution. So we need to get oriented to that also. Even though we get oriented to the new technologies and the AI is improving, and so many robotic techniques are coming in the surgeries and the nursing techniques, and the care plans are coming in a form of a it's like a care plan, like a computer based care plans all coming. So all these things we have to update our knowledge. For that we need to have a in service education. Let us see what is in service education. In service education is the planned learning experiences provided by the employing agency for the employees. That's nothing but the employer is voluntarily coming forward to offer the in service education or offer the training courses for the employees in order to get the in order to achieve the educational or the healthcare industry's objectives or goals. So they are coming forward and motivating the employee to go for the training. It is called the in service education. This is the main aim of in service education: to develop the right concept in the client care, to maintain the high standard of nursing care, and to observe or bring changes in the staff behavior, to develop the scientific skills required for the practice, to provide the staff members for the promotion. If you go for this in service training, you will get the promotion, to promote the safety and efficacy in the personnel in their work situation, and to reduces the staff turnover or the staff absenteeism. This is the main aim of in-service education. What is the nature? How this in-service education, what should be the characteristics or the nature of in-service education? It always should be according to the current need of the situation. It should create some interest among the employees, and then it should be motivate the employees to participate. They should not be so worried to participate it. They should be happy to participate. It should be so dynamic, and it should be planned within the budget, and it should be well organized by the employer. What is well organized? Man, money and material should be organized. This one. Okay, if you do all these things, what is the scope or the uses of in-service education? Organizing, putting the money and the energy to improve the knowledge and the skills of the employees, to retain the staff in their institution for the longer time, to develop the new skills among the employees for the organizational development. If they develop the new skill, it's good for the organization. And also to introduce the new technologies. For example, the hospital is, we are introducing the robotic heart surgery. The nurse should know how to operate how to assist the doctor who is operating the robot and doing the surgery, and to improve the good human relationship. And it gives an opportunity to coordinate with the other departmental staff, and also for the staff development. How they develop the good human relationship, it is giving a good opportunity to meet with the great peoples, and they will have a get together, they will have a great lunch together, and they will exchange their ideas. They come out with the new ideas. These are all the giving an opportunity for the individual to attain some of the self development, and which will promote the organizational development. Same way, the need for in-service education. Need is for the capacity building of the employees, and the employees have a great job satisfaction, and to bring the necessary changes from the employees, their attitude, their knowledge, their behavior, and to bring the productivity within a short time, to improve the productivity of the organization, to provide within the job setting. That is the main need for the in-service education. What are all the types we can conduct the in-service education? Types, like how they are when you are joining new to an organization. The in-service education in a form of a orientation and the skill training program. What do you want to get oriented? Once you are joining in a new organization, you should understand you may studied in a different colleges, different schools, different university, but when you come together you have to understand the uh, employees policy or the organizational policy, rules and regulations, protocols, standing orders, instructions and the rules. For example, in Saudi Arabia, to giving medication, we have learned about 7 rights, 8 rights, but all these rights they have added that even you are giving one medication, the two nurses has to, in front of two nurses, the patient has to take the medication and two nurses has to record the sign it. That is the policy of that hospital. So unless until we are not conducting orientation skill training program, so many errors will be coming. So by this orientation and skill training program, you can reduce the errors. Next is a continuing education program. Continuing education program is like an ongoing, periodically arranged program by the employer to the employees. Who is taking care of this continuous education program? There will be a team members will be there. Especially if you go and see the hospitals, there will be a infection control team members will be there. Along with them, they will organize the workshops and other thing for continuous program. For example, they will have a calendar event. For example, they will tell that hand washing or the infection control or needle stick preventions. So like that, like a CPR or the medication calculations or the fire and safety, sir, or the some protocol program will be there as a calendar event. It will be continuously they will be doing. Other special programs are called the leadership training program. The leadership training program is also to develop the leader from the organization. It will be helpful for them to attend this, give the employees to the promotion in their area, and the management and the skill development program and staff development program. The staff development program also is an important, it's also continuously done by the organization with the help of the employer to the employee. Okay, how we will plan? What is the planning formula for this in-service education? We have to think what to be done, how to be done, where to be done, when to be done, why it has to be done, what is the necessary, and who should do that. So these are all the question has to it should be in your mind. So you have to keep all these things and you have to think about the what kind of strategies or protocols you are going to follow to conduct the in-service program. So most of the staff cannot, because it's a 24-hour into 7-hour service, everybody cannot attend. So are we going to conduct this as online learning or open learning, or we are going to CBT like a program? Already you will have a training module or something. In a leisure time your staff can read it and do it like a form of a programmed instruction kind of a in-service education are we going to give, or the digital learning or web-based learning or blended learning or offline program hands-on training you are going to do. So these many things you have to plan. So while planning you have to think where, when, you have to triple M, you can remember it. What is triple M? Man, money and material. The man is a resource person. It's a very important. The resource person is the one who make you live in the program, will create the interest in the program, will attract the employees and to put the all the knowledge into the mind of the participants. So you have to select the resource person in the right manner, and the materials you have to provide them certificates, or you have to provide them incentives, or you have to you have to resource person you have to provide the remuneration, you have to provide them all, you have to plan. And what is the handouts and other things, take home messages in a form of this one, books or diary or anything you are going to give. So you have to think about it, and you have to keep some of the principles in your mind while you are preparing. So the time should be suitable, which is the preferable time, where the patient's time will be patients are less, or of post lunch or pre lunch or post lunch you have to plan it. And it should be creative, the topic should be also interesting, and it should be selection of the topic should be very creative and interesting. Selection of the resource person is one of the important aspect, and it should avoid the duplication of the work. So already they have learned in another name same thing, it will be like monotonous and it will be duplication should be avoided. and then if you give some credit points or issue some certificates, it will be really motivate the employees. And the regular regular finding out to ensure the ongoing conducting of in-service education. Also, it should provide the professional development and the job satisfaction. So all these things points you have to remember these principles while preparing the in-service education. Okay, so we know how to give, how to select the topic, and what is the form of in-service education whom we are selecting. Okay, now what is the steps for the planning in-service education? First, you have to develop the main goal. What is the goal of in-service education? After attending, at the end of this in-service education, all the faculty will be able to operate the new infusion pump without knowledge and the skill they will develop at the end of this one new infusion pump, or the new ventilator machine, or that robotic care, or they could be able to use the computer based care plan with a limited time. So you have to set the goal at the end of this in service education. All the employees can able to operate so and so. So you have to then determine the course of actions. So they can able to operate the computer, they can able to put the data, and then they can assess, they can do follow up, they can open, and all these things you can do the specific objectives. And you have to assess the available resources. For that you are going to teach about the computer. So before that workshop, you cannot on hands-on training, you cannot use the employees cannot exceed more than 20 to 30 people. So 20 to 30 computers are ready with the internet. You have to see the material, and then you can give them one model, and then how many resource persons are there, how many moderators, one moderator will be there, how many people are going to help, who is going to lead it, and the material, the computer is available or not. Then you can organize and conduct the program within the budget. You can rent the computers and you can take it back. You can talk with the package, the people who is coming and giving that, and then you can evaluate the results. How do you evaluate? You can take a data that how many nurses were really implementing the care plan. That you can take a data that will show the effectiveness of the in-service education, and then reassess the goal and update the plan periodically. Okay, now we have seen you have used this computer. Now we are going to install the new software. This software will be giving you options, so you have to click so and so. So that doesn't need much time. That is only periodically. Any one go to one area, they can introduce the new software and very easy. But the big one, you need to take the in-service education. Small installation of some software and updating that. It is easy for one person giving training. That particular person will go and train all the people in the particular area. Okay. What are all the approaches for in-service education? How to have sorry. What is the approaches of in-service education? The approaches was a centralized approach. Next one is a decentralized approach, and then will be the coordinated approach. What is centralized approach? Centralized approach, it is very easy. It is well planned. It's like a calendar event. Centralized approach, already the fund is being allotted and the resource person will be coming. All the department will be motivated to apply this, attend this in-service education. The fund also will not have any problem, and budget also not have any problem, and there is no conflict between the employers and employee, and there is everything will be systematically planned. Decentralized approach, it's like within the department. Most of the time selection and conflict will be coming in service, who will be doing, who is doing that, but how you can avoid that one. So you can coordinate with the to avoid or overcome with the decentralized approach. You can coordinated approach with a neighborhood department. Then both you can do that in service education. That will be really supportive. So this is a three kind of the approaches we are following in the in service education. What are all the methods of conducting in service education? So the methods will be like a forum, or the workshop you can, what teaching in a form of what teaching or in form of a laboratory teaching, or it can be seminar or workshop or conferences. So these are all the methods you can conduct the in-service education. So what are the factors which will be affecting the in-service education? Like as usual we tell, cost is the one of the important factor, and the manpower and the resource person. Manpower, mainly the resource person, selection of resource person is an important, bringing whom to bring, like that. That is the main. And the timing is also another challenge, because 24 hour into 7 hour service is the healthcare, this one. And how to overcome, what the strategies to overcome. So how you will overcome these factors? So you have to create the regular funding, and regular funding there should be one person should be allotted every time, those he will be taking care of it. So periodically checking what is the lack of knowledge, and it should be compulsory. And motivation, you have to issue some certificates to the employees, and the points has to be included, and then the promotion can be given. And then this one, cost can be, fund can be generated by quarterly, though the burden will be reduced. So so in-service education is very much essential once we complete and working in an organization, to update our knowledge and skill and attitude, mainly by the employees. So employer is giving to the employees voluntarily in order to achieve the, you improve the knowledge and skill of the employees in order to achieve the goals of the organization. So this is the conclusion of the in-service education. Thank you.